And we'll use the cadavers with all this water coming down. We really can't get the cadavers out, so hopefully that'll be available for tomorrow. You'll see here are the ventral roots, and then this is the part that I want you to know, the chords. So we have lateral and medial chords, posterior chords in the back. You can see it creates this letter M right here as it wraps around the subclavian artery. Okay? So that's what I want to diagram on the board, and those are the nerves that I'll talk about as we look at each of the different compartments of the upper extremity. It's on page 48, I believe, in the first packet on the peripheral nerves. I believe that page 50. Page 50? Okay, thank you. I think the diagram is page 48.
Yeah, the cervical.
Okay, page 52 is the diagram. Yeah. So 50 and 52. All right, so let me put this up on the board. And over here on the right, I've kind of written the nerves and the different muscles and compartments that they innervate. So I left that up from this morning. So the upper portion, the more superior portion, forms the lateral cord. And then the more inferior portion forms the medial cord. And off of each of those, this is how we create the letter M. Okay? So this is lateral cord. And it's going to be the thumb side portion of our brachial plexus. This is medial cord. And then in the back, I'll draw this in a dotted line. We have the posterior cord. So this is again what's highlighted in yellow on the diagram. Now we have talked about some of the muscles innervated by these nerves that are coming off closer to the spinal cord itself. So suprascapular nerve up here is going to supraspinatus. Long thoracic nerve goes to serratus anterior. Dorsal scapular goes to the rhomboids. So when we talk about damage to these nerves, let's say that you've got a backpack with 50 pounds of books in it, all right? And instead of carrying it over both shoulders, you sling it over one shoulder. And that's going to press down on the base of your neck here and can lead to damage to this region of the brachial plexus. All right, so you can lose the nerve to the supraspinatus. You can lose C5 and C6, which are going to do the axillary nerves. So that can lead to sensory loss. Remember sensory dermatome over the shoulder with C5 and C6. So the shoulder region can get numb, and you may have weakness or loss of the ability to abduct the arm. If you're using crutches, and instead of placing, the proper use of a crutch is to place your weight on the arm, the hands rest here, not on the actual part that goes under your axillary area. If you're doing that, you can push up on this region and have damage to the ulnar nerve. So that's coming down the little finger side. So you may have numbness or weakness or absence of function of muscles in that region. Okay? So those are the cords, and now let's talk about the nerves that we're going to use today that come from these cords. The lateral cord forms primarily this nerve of the anterior arm compartment known as the musculocutaneous nerve. It's sensory from the lateral forearm and motor to the anterior arm. All right, so that's the first one we're actually going to talk about, is that anterior arm compartment. The medial cord is going to give rise primarily to the ulnar nerve. It runs along the little finger side of the forearm. Most of its muscles are in the hand, and we'll talk about those tomorrow. Then the lateral cord and the medial cord give off components that run down the middle of the arm and forearm and do most of the muscles of the anterior forearm. And this is called the median nerve.
Say it again.
So it's going to do muscles of the forearm. You can see it. Let's see if there's a... So this is the median nerve right here. It runs down, both of these are median nerve, runs down the middle of the forearm and does most of the muscles in the forearm. All but 1.5. Okay, from the posterior cord, we have two nerves. Up high, we have the axillary nerve. We already talked about the muscles innervated by the axillary nerve. They're listed up here on the board. So teres minor and deltoid muscle are innervated by axillary. And you can see that one right up here. Here's teres minor. And remember, deltoid is going to fit down here. So this nerve, the nerves are yellow on your model. So this nerve right here that wraps around the neck shaft of the humerus is the axillary nerve. Okay? The seventh, there are 7 questions on the quiz tomorrow. One of them will be identify a nerve. Okay? So that's axillary. It'll be, and then the rest of the posterior cord continues as the radial nerve. So you'll be asked to identify one of these nerves. Not the cords, but one of these nerves.
Can we just make it the cords? It's easier.
What's the first nerve right there, the one that goes
This one?
No.
Musculocutaneous. Musculocutaneous. So it's skin and motor. So notice this M. Again. Okay, we won't be able to see the posterior cord and the muscles in this fashion because it's behind, but you can see the radial nerve, and I'll indicate it to you when we look at those muscles. So let me turn this off to show you a higher contrast. So again, here's the lateral cord forming the musculocutaneous nerve. Here's the medial cord forming the ulnar nerve, and the two together form median. And posterior cord giving off axillary and then becoming the radial nerve. Okay. So if we look here, here's that same M line again. Musculocutaneous disappears into the anterior arm. Median nerve continues through the anterior arm to anterior forearm, as does ulnar nerve, and then the axillary and radial are behind that. Okay. And we'll look at this tomorrow. You can see those. Some of them I showed you where the nerves were in the cadavers on Friday, but we can see that tomorrow. Okay. So we are going to look at muscles of the anterior arm first, and it's this region right here. So here's that same M line, and there's a little bit of musculocutaneous that you can see going into the anterior arm. So this is on page 31. If you'll turn to page 25, kind of hold your place there. 25. Yeah, page 25, I have a chart. So I list each of the compartments and the nerve that innervates that compartment. All right? So it's a lot easier to learn them by compartments than each individual muscle. So if you're making flashcards, you have a flashcard for flexor carpi radialis, and it's innervated by the median nerve. don't learn the nerves individually like that because you'll get overwhelmed by all the levels, amount of detail that you have on each card. Learn them by compartments. Okay? Question?
Yeah, where's the radial nerve again?
Okay, radial nerve is going to pass posterior. So in this M right here, it's behind the blood vessel.
Okay.
So we can see it if we can move the blood vessel on the cadaver. And then it disappears into the posterior compartment of the arm. So on this model, here's the anterior compartment, and here's the brachial plexus structures.
Okay.
All right. When we turn around, this is triceps brachii, and here's the lateral head has been removed. Here's radial nerve running through posterior compartment. Here's radial nerve. Here's radial nerve, and all of the ones on the back of the hand are radial nerve. So you'll see it in the posterior compartment of the arm and the forearm. Okay?
Thank you.
So now the first compartment we're looking at is anterior compartment of the arm. You can see a tiny little piece on this model. You can't see it at all on your big models. All right? You can see a tiny little piece of this model piercing this first muscle right here. If I ask you to identify musculocutaneous nerve, however, it'll be like an M picture like this of the brachial plexus. If it's on the model, notice when I take off this superficial muscle, there it is. So you can actually see a lot of the musculocutaneous nerve deep within the anterior arm compartment. All right? So let's look at that compartment. May I erase the board? Because I'm going to draw the bones.
Can you leave the right side of the board?
Yeah, I'll leave that up for the
Okay.
entire lesson.
All right.
One piece. Stay on. So we're looking at the muscles that cross the shoulder joint to the humerus, so from scapula to humerus, and then from humerus to the forearm. So I got very impressed in that.
Good job. Well, that looks like a humerus and a scapula. Really big scapula.
And then we have the coracoid process coming off of the anterior surface.
It's the beak.
So this would be the coracoid process right here. Okay. And then our lateral bone is going to be the humerus, the radius. And we have the ulna. Do you want to take a picture of that? Then you can print it off and practice drawing your own muscles. Okay?
No, I know, it's online. I didn't do it. She's through.
Watch this freehand right here. Can I help you train your beautiful word structure? That's really cozy. Just remembering. No, it's really weird how it is stretched out. My arm is so huge. Let me let's see why people.
So we have three muscles of the anterior compartment of the arm. One crosses only the shoulder joint. One crosses only the elbow joint, and one crosses both. Okay?
No, you are.
So the muscle that crosses only the shoulder joint is the coracobrachialis. It's that really slender muscle that's pierced by the musculocutaneous nerve. So it's going to come from the coracoid process, and it's going to insert onto the shaft of the humerus. So this is coracobrachialis.
Note that it is in front of the shoulder joint. So it's not going to extend. It's not lateral. It's not going to abduct. It's in front of the shoulder. So it's going to adduct. It's going to pull the arm in, and it's going to flex. It's going to pull the arm forward. Okay? So our anterior compartments do flexion. They don't do extension. So adduction and flexion of the humerus. It doesn't cross the elbow joint, so it's not going to do anything like this. All right? Name for its attachments. Brachii means arm. So coracoid process to the arm. It's our coracobrachialis, innervated by a musculocutaneous nerve. I'm going to do the deeper muscle next because I'm going to cover over it with biceps brachii. And so what I'm going to do is brachialis. It's covered up by biceps brachii. So let's look at the next image here. So here is coracobrachialis being pierced by the musculocutaneous nerve, and here is brachialis. All right, so it starts about halfway down the humerus for its origin. It doesn't cross the shoulder joint. It is our main flexor of the elbow. So what bone is it going to insert onto, the radius or the ulna? Ulna, because that's the one that forms our elbow joint. All right. So it's going to insert onto the coronoid process, that little sharp lip of the ulna. This is the agonist, or the prime mover, or flexion of the elbow. Notice it also has the word brachii in its name, because it's an arm muscle. Now on these large models, you cannot take off the muscle that covers it. So if you look lateral on the thumb side, you'll see this thick fat muscle right here underneath our biceps brachii. So this thick fat muscle right here is brachialis. All right, so on the opposite side you can see coracobrachialis. And then here you can see brachialis. And in this model, it's covered up by our better known biceps brachii. On this model, the biceps brachii I was able to take off. So now you're seeing the brachialis with the musculocutaneous nerve superficial to it. Okay? And that's the best view we have of the musculocutaneous nerve. The next muscle is the biceps brachii. It also has the word brachii. It's going to cross both joints. So coracobrachialis only crosses the shoulder joint. Brachialis crosses only the elbow joint. It flexes the elbow and is the prime mover for that. Biceps brachii is going to do both. All right, it's going to cross the shoulder joint and the elbow joint. Because it crosses the shoulder joint, it does the same thing as coracobrachialis. It flexes the humerus and it adducts the humerus. All right? Because it crosses the elbow joint, it helps the brachialis to flex the elbow. It's not the prime mover, but it helps. It is the prime mover for this movement. Anybody remember what this movement is?
No.
Turning the hand palm up as if you were going to hold it. There you go. Supinate. All right? So biceps brachii is the prime mover, the agonist for supination. If you recall looking at our skeleton, anatomical position is with the radius and ulna parallel. And then when we pronate, we cross the radius over the ulna. Now if we supinate, we grab the radius and pull it back again. Here's a key rule to remember. Any muscle that supinates or pronates has to insert onto the radius. Okay? If it's a supinator or a pronator, its bone of insertion is the radius. Now biceps, bi means it has two heads. All right? So one head is a short head, one head is a long head. And if you look up here, wrong picture, let me change the image. Obviously I've lost my hand. So if you look at this image, here's our coracobrachialis, and here are the two heads for biceps brachii. The short head also attaches to the coracoid process. The long head looks short, but it goes over the top of the head of the humerus and attaches to the glenoid fossa. So it has a longer distance to travel. Remember the greater and lesser tubercle had a groove between them? The intertubercular groove or sulcus? That's created by the presence of the tendon or the long head. Okay? So even though you can't see all of the long head, it has a longer distance to travel. So from the top of the glenoid process through the intertubercular groove is the long head. From the coracoid process is the short head. And it's going to come and insert onto the radius because it's a supinator. And I'll leave part of the brachialis showing, even though this really covers up most of it. And inserts onto that radial tuberosity. So long head. Short head. Biceps brachii. So these are the three muscles of the anterior compartment of the arm, all of them innervated by musculocutaneous nerve. One crosses the shoulder, coracobrachialis. One crosses the elbow, brachialis. One crosses both, biceps brachii. Okay. Now so far we've talked about three muscles that attach to the coracoid process. Two of them you can see right here. They have their origin from the coracoid process. Coracobrachialis, the short head of the biceps. The third muscle we talked about last week inserts onto the coracoid process. Anybody remember what it is? Pectoralis minor. Okay. So it's going to pull on the coracoid process where these two muscles pull on the humerus or the ulna or radius. Okay, well, on the radius or humerus. Okay. I'm going to stop here and give you some, actually let me do the triceps and then we'll take a break. Because I know you didn't have lab time to do the supraspinatus and infraspinatus. Okay? So let me take a picture of this if you want, and then we're going to look at the posterior compartment of the arm. And then we'll take a break, a lab time break. The anterior compartment. The problem with these models is the forearm is twisted. So it's as if you were having it by the side. When you look at the anterior arm, then you have to rotate it to see the anterior forearm. Right. So this is anatomical view. Yes. Yeah. The remember radius is lateral. So the ulna's going to be on the medial side, on the head side, and scapular side, and radius is the lateral side. Sorry. It's okay.
Okay.
All right, so we're going to move past the anterior forearm. We'll do that after the lab break. So turn to page 35, and that's the posterior arm. Okay.
I don't know. I think this anterior will go up somehow.
So I'm going to flip the scapula over.
Now we're gonna.
I know I put on the table, this whole thing looks shit.
go down. It'd be funny. Like I didn't have it just. Spina bifida.
So posterior compartment of the arm, as well as posterior compartment of the forearm, are all innervated by the radial nerve. Okay, so when you think radial nerve, think posterior, period. We see the same thing on Tuesday, maybe a little bit tomorrow when we get to the lower extremity. The tibial nerve does all the posterior thigh and posterior leg. All right, so we have that same pattern. So radial nerve over here does go into the triceps brachii and posterior forearm. We'll do the posterior forearm after a lap, our first lap break. So there are actually two muscles of the posterior arm. We're just going to do one, the triceps brachii. So it has three parts, as you can tell, in the name triceps. Only one of them crosses the shoulder joint. All right? So one of them has its origin on the scapula. The other two have their origin off of the humerus. They all function, this is the agonist, this is the prime mover for extension of the elbow. So they all have this common insertion on the olecranon process of the elbow. The long head is the one I mentioned on Friday that you can use to separate teres minor from teres major. That's the one that crosses the shoulder joint. Okay? The lateral head, I'm missing part of it here. The lateral head is right here, and the medial head is a shorter one on this side. So kind of think of it like a hot dog in a bun. The hot dog would be the long head of the triceps, and the two sides of the hot dog bun would be the medial head and lateral heads. All right? So let me diagram that, and then I'll come around and make sure you can see all those heads. So the easiest one to find right here is the one that crosses the shoulder joint. So it's going to come off of the lateral border of the scapula. And remember, they all insert onto the ulna because they do extension of the elbow. So this is long head. Of the triceps. All of them innervated by radial nerve. The lateral head comes off the shaft of the humerus. And joins, so they still have the common insertion at the olecranon process. And the medial head comes off the shaft of the humerus but lower down. So triceps brachii. So the medial head is really short and it's right here. Okay? So
On the picture, on the diagram.
on the picture, it's not, it's right here.
But it's not.
It's not labeled. So this would be long head, this would be lateral head, and medial head is right here. So remember I said like two sides of the hot dog bun? Okay? So on your model, here is coracobrachialis, biceps brachii, short head, and if we take off the deltoid,
You can do it.
just have to get the right angle. Thank you.
Here would be long head. And then triceps. This is the lateral head that I'm putting in. So here's long head. Here's lateral head. And then down here is medial head. Okay? Brachialis is going to be right next to lateral head. The fat part that you can see there. Okay? So let me come around to each of you. Okay, so coracobrachialis, biceps brachii, short head and long head. Here. Brachialis there. And then a posterior compartment, long head of triceps, lateral head of triceps, medial head of triceps. This is a piece right there.
Okay.
So it's easier to find long head, and then you have lateral and medial wrapping around it like that. Okay?
Thank you.
Okay, so coracobrachialis here, really slender one. Short head of the biceps, long head of the biceps, in between the greater and lesser tubercles. All right, and then brachialis is here. It's underneath, of course, I have a bed for it. And then now we have to rotate this over. So all of this is triceps. Long head, crossing the joint. All of this is lateral, right next to brachialis. And this down here is medial. Okay? Yeah. Okay. This would be radial nerve here on top of it, yes. So back here. Okay? Alrighty. So let's take off the, here would be the coracobrachialis and brachialis. And the two heads of the, so this would be the short head and the long head. And then we turn it over. And here's the long head of triceps. Here's the lateral head. And here's the medial head.
Shut up, Joe.
So those are kind of wrapped around.
Over it, man.
Keaton Trader because you shaved his face.
So over it.
Doesn't he look like a baby? I know when I
Okay, I'll come back to start lecture at 12:15. Okay, you're about.
It's so cold outside there.
Here's coracobrachialis. Here's coracobrachialis. Biceps brachii short head associated with the coracobrachialis. Long head is kind of up in here. I'll never tag it like that. You'll see it. It's right here going over the head.